You've missed your period for a few days. Your body feels a little different, a bit tired. Maybe your breasts are tender, or your emotions are all over the place. And then the question quietly creeps in. Am I pregnant? And if I am, is the baby growing safely in my uterus, or could something be seriously wrong? In the very early weeks of pregnancy, every sign matters. Because while it might be the beginning of something beautiful, it could also be your body silently warning you of a dangerous complication, an ectopic pregnancy. In this video, you'll learn 5 early signs that may mean you're pregnant, and more importantly, 3 warning signs that could signal an ectopic pregnancy, a condition that can be life-threatening if not caught in time. What you're about to hear could save your life, or the life of someone you care about. So please, pay close attention, and don't delay seeing a doctor if anything feels wrong. And if you know someone who's pregnant right now, send them this video. It could make all the difference. Let's begin. 1. First sign. A missed period, but something feels different. A late period is the most common early sign of pregnancy. But if your cycle isn't regular, it's easy to overlook. The real clue isn't just that your period is late, it's that your body feels off in a way you can't explain. Maybe your breasts are sore, your sense of smell is suddenly stronger, or you just feel like something new is happening inside you. 2. Breast changes and tenderness. This doesn't feel like your usual PMS breast pain. When you're pregnant, the tenderness tends to last longer and feel more intense. Some women describe it as a deep ache or a constant pressure in their breasts. You might also notice the area around your nipples getting darker and veins becoming more visible. This is due to rising levels of estrogen and progesterone preparing your body to support a baby. 3. Unusual fatigue. Even when you've done nothing all day, you wake up in the mornings and already want to crawl back into bed? That's one of the most overlooked early signs of pregnancy. Why does it happen? Your progesterone levels are rising rapidly, which can make you feel exhausted, foggy, and drained, even after a full night's sleep. This can start as early as a few days after conception and gets more noticeable each day. 4. Light spotting. Easily mistaken for a period. Some women notice a small amount of light pink or brown spotting, lasting just a day or two. This isn't your period. It's called implantation bleeding, and it happens when the embryo attaches to the lining of the uterus. Here's how to tell the difference. Implantation bleeding is usually very light, doesn't last long, and isn't accompanied by heavy cramps or clots. But if you notice bright red bleeding that continues for days, it might be something more serious. And that brings us to the second half of this video. 5. Emotional swings. Crying easily, snapping unexpectedly. You find yourself tearing up over a commercial, or getting irritated for no real reason. That's not just stress, that's hormones. Mood swings in early pregnancy are very common, and often one of the first emotional signs something is different. If you feel extra sensitive or emotionally off, especially along with the physical signs above, you may want to take a pregnancy test. But now we move into the most important part of this video. The 3 warning signs of an ectopic pregnancy. An ectopic pregnancy happens when the embryo implants outside the uterus, usually in one of the fallopian tubes. This is a medical emergency. If the tube ruptures, it can cause severe internal bleeding and be life-threatening. It occurs in about 1 to 2% of pregnancies. So let's talk about the signs that you must not ignore. 6. Sharp or one-sided lower abdominal pain. This pain usually appears on one side of your lower belly. It might start as a mild cramp, but slowly becomes sharper or suddenly becomes intense. Women describe it as a strange, stabbing pain that doesn't feel like normal period cramps. If you feel this kind of pain, especially with bleeding, seek medical care immediately. 7. Abnormal vaginal bleeding. Not like your period or implantation spotting. This bleeding may be bright red or dark brown, and often lasts longer than typical spotting. It doesn't follow your usual cycle pattern. It might come and go, or be constant, but if it happens after a positive pregnancy test and it doesn't seem right, get checked. Many women mistake this for a light period, and that delay can be dangerous. 8. Dizziness, fainting, or shoulder pain. This one surprises most people. If the fallopian tube ruptures, internal bleeding can irritate the diaphragm, causing shoulder tip pain. At the same time, blood loss can make you feel dizzy, faint, or extremely weak. These are signs of internal bleeding, and they are a medical emergency. If you feel any of these, call emergency services or go to the ER immediately. So what should you do? If you're showing 2 or more early pregnancy signs, take a test, preferably in the morning when hormone levels are highest. If it's positive, congratulations. But if you also feel one-sided pain, persistent bleeding, or faintness, even if the test says pregnant, go for an ultrasound as soon as possible to confirm where the pregnancy is located. Ectopic pregnancies cannot be saved, but when caught early, they can be treated with medication, avoiding surgery or complications. Final thoughts. Pregnancy can be a beautiful beginning, but it also requires you to listen closely to your body, because sometimes the smallest signs are the ones that matter most. If this video helped you understand what to look for or gave you peace of mind, please let us know in the comments. And if you know someone who's trying to conceive or might be pregnant, share this video with them. You could literally be saving a life. Thank you for watching all the way to the end. Don't forget to subscribe. And stay tuned for our next video. How to know if your baby is developing normally in the first trimester.